Mr. Sanders?
Dr. Buchanan, I think typically you all start with the assisted, either Dr. Zusa taking over, or you sometimes take roll first. I'm not sure there's a set form for it. I also don't think you're streaming on YouTube yet. I'm not seeing any indication that you are.
Okay.
We are live.
It says we're live on YouTube on my screen. And now we're recording.
So you may want to start over. And
Sure. Dr. Gocher's not going to be able to be here this evening. He will join us if his case allows. So we will need to elect a chair for the evening to chair the meeting. I'm happy to entertain nominations.
I nominate Dr. Sosa as Mayor Jacobs.
Second.
Dr. Souza, are you willing to chair this evening?
That's fine.
Okay. So I make a motion that nominations cease. And do we have a second to that?
Second.
Okay. So all in favor of Dr. Souza chairing the meeting? We'll have to do a roll call, Narda.
Yes, ma'am. This is Narda Capicelli. Diana Drake,
Yes.
Dr. Hurt, excuse me, Dr. Hurt,
Okay, yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan?
Yes.
Passed unanimously. Thank you.
All right, seeing that it's 5:05, we will call the meeting to order. Narda, if you'd like to go ahead and start us off with a roll call.
Yes, ma'am. This is Narda Capicelli taking roll call. Dr. Drake?
Yes. Here.
Hurt?
Here.
Mayor Jacobs?
Here.
Dr. O'Brien?
Present.
Ms. Roma?
Here.
Dr. Shamia?
Here.
Dr. Sousa?
Here.
Ms. Wagner?
Present.
And Dr. Buchanan?
Present.
9 attending and 1 absent. Thank you.
Thanks, Narda. We've established a quorum, and so now we just need to set and approve the agenda. The agenda was sent out, I believe, on yesterday for today's meeting. Are there any additions, changes that need to be made?
Yes, Dr. Sosa, this is Mayor Jacobs. Randy Burleson from Aubrey's had contacted me and would like to address the board during or concerning the COVID-19 restaurant occupancy limitation early closing regulation. I would like to ask for permission to allow him to address the board during that agenda item, please.
Do I hear a second? I'm assuming that's a motion.
Second.
Any further discussion? Okay, any other proposed changes to the agenda? Otherwise, we can vote on that revised agenda.
The only other thing is we can approve our minutes from the Friday's meeting. They are complete, so we can approve those and go ahead. So add that to the agenda, approval of minutes from whatever 11/20/2020.
Okay, that's fine. I don't know if do we need a second for that?
Sure. That's approval of the minutes.
I'll
Great.
second.
Okay, any other items that need to be added? Okay, hearing no, I guess I'll entertain a motion to approve the agenda with those 2 items added to it.
I make a motion to approve the agenda as amended.
A second?
Second.
Thank you. Narda, if you could do a roll call to approve the slightly revised agenda.
Yes, this is Narda Capicelli, and we are setting the agenda with 2 items added. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Tania.
Sorry, yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes,
Thank you. Passed unanimously. Thank you.
Okay, great. So we will, before we get into the review and discussion, has everyone had an opportunity to review the minutes from Friday's meeting? Any additions, deletions, corrections? If not, do I hear a motion to accept them?
I make a motion, we accept the minutes as written.
A second.
Okay, any further discussion? All right, Narda, if you can do a roll call to approve the minutes as submitted.
This is Narda Capitelli, approval of minutes, vote. Dr. Drake,
Yes. I have trouble with that.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes,
Passed unanimously. Thank you.
All right, thanks, everyone. So next on the agenda is our review and discussion session. I guess we would start with the first item labeled 2020-A, which is the COVID-19 risk reduction guidelines. I guess discussion, I'll just open it for discussion at this point.
Dr. Souza.
Yes, ma'am.
I'm wondering, in out of respect for Mr. Burleson's time, would the board be okay with moving the restaurant regulation up to the top of the agenda so that we can, I know we just approved the agenda, but just to move that up so that he doesn't have to sit and wait for us to get to it.
I don't have a problem with that. Is he on with us?
We're
Or is he
getting,
calling in?
he's sending him the Zoom link.
Okay. See, I didn't see him on with us.
So when he,
But-
yeah, so when he joins us, maybe we could go to that agenda item. Just a thought, just to respect his time.
Okay, no, that's fine. I don't, does anyone have any objections to that?
Thank you.
Okay, I don't think that those are numbered within number 5 on the agenda, so I think that we can probably move around. I guess, do we have any indication we'll be here in 2 minutes or 10 minutes? Because we could go ahead and start discussing the first one.
I would go ahead and start discussing.
Okay.
We're sending him the link by email, so.
Maybe a
I'm not-
minute.
Somebody else is doing that, so.
Okay.
So there we go.
So I guess the first one, the 2020-A, I don't know, Dr. Buchanan, if you wanted to maybe give a quick overview. I think that you worked with Mr. Sanders on this, is that correct?
Yes. So first I'll start with a motion that we approve.
Second it.
Okay. And now we can discuss it.
So this is kind of a restatement of a previous resolution or regulation, I don't remember what it was called at the time, that we passed, that Dr. Shamia brought, that just kind of adds a little more to the 5 core actions, really encouraging businesses and citizens to follow the 5 core actions and giving some more specific guidelines on how to do that. We just really feel like we can't restate the 5 core actions, and giving people practical ways to follow the 5 core actions, I think, is helpful. It's not binding in any way. It's just a resolution recommending that people follow the 5 core actions at home, at the office, and anywhere they are. So that's it. Does anybody want to see it? Everybody has it, but we can screen share it if you'd like.
It'd probably be good to screen share.
Yeah, I agree.
Here it comes. I'm happy to answer questions.
Could you maybe zoom and make it a little bit bigger, just so that it's easier for folks to read?
Are you doing this? Okay, there we go.
There you go. Perfect, thanks.
I guess get to the resolve, maybe.
Yes.
I'll start off by just saying that this is very good common sense for all of us to follow. We really, as a community, need to be doing these things very consistently. And I would just say that what we're talking about tonight might be something that we could not do as harsh of regulations potentially if we can get people to do what's on this list right here. And especially during this next week, between Wednesday and next Saturday is our most critical time for that will affect us probably for the next 2 to 4 weeks. So if we can get people to listen and to act with these sorts of items, it can make a huge difference in our community, much more so than us regulating specific areas. So I just want to strongly encourage the public, all of us, to be able to try all of these as soon as possible, continuously.
So, Dr. Buchanan, this is Dr. Shamiya. So just a couple thoughts. First of all, I think this very much captures the intent of what we talked about on Friday, is the idea of just the 5 core actions plus some practical thoughts that some people really haven't seriously thought about since back in April, for example. And so just two practical things, and I don't know that these need to be called out explicitly because they're implied, and I also don't know to what extent this will really kind of be consumed by the public. I know that the desire is that between the public seeing it and the media seeing it, that it does get really disseminated. But one practical issue is carpooling with non-household contacts. So I don't know if that would be worth calling out explicitly. Again, it's implied, but people just don't think about the fact that when you get in the car, that's a really close contact. And that is absolutely prime time to potentially transmit COVID if you're not with a household contact. And the other is simply that when you have visitors in your home who are not household contacts, the idea of the 6 feet and the masking, I think that one's even more implied. I mean, it's just, you have somebody coming to repair something in the house, then mask 6 feet of distancing because that person is not a household contact. So just throwing out whether those one or both of those, and I'm not married to either one of them, would be worthwhile additions.
I mean, I'm not opposed to that as a friendly amendment. Those are easy additions to make. So if you'd like to make that as a friendly amendment, I will accept that.
I don't know if we have to do those as one at a time, but so I first a friendly amendment of carpooling to recommend against carpooling with non-household contacts.
So Mr. Sanders, clarify me if I'm wrong, but could we have both amendments, friendly amendments, as long as the person that first and second is okay with them?
Yes.
Okay. Yeah, so we can do them together as long as Dr. Buchanan and Ms. Romer are okay with it.
Sure.
Okay, got it.
So the second one would be, you're muted.
Essentially, wear mask and maintain 6 feet of distance from anyone visiting your home whom you do not live with or who is not a household contact.
Okay. Dr. Drake, are you okay with those amendments?
I am.
Okay. Any
Further discussion?
Yes, I
Sorry,
like,
Dr.
I'd like to make a friendly amendment too, to add a bullet that encourages retail outlets, especially grocery stores, to have special hours for vulnerable populations only.
I'm fine with that. Miss Dr. Draker, you fine with that?
I am.
Further discussion or thoughts? I think some grocery stores are doing that now, which I think is very helpful.
Mhm.
Hearing no more discussion or thoughts, Narda, would you like to take a roll call to approve this 2020-A? Is that going to be it'll stay as that, or does it need a number?
I chose that you put a letter on it to make it different than the regulations.
Okay, that's fine. Just want to make sure we know what we're doing. So 2020-A. So Narda, if you could do a roll call, please.
Yes, this is Narda Capitelli. This is for resolution 2020-A approval. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes, yes.
Passes unanimously. Thank you.
Thank you, Narda. So we will move on to 2020-7. Do we have Mr. Burleson on the line?
I don't see him.
Okay. I don't either.
Hold on. Mr. Burleson, are you on the line? Okay.
So do we want to go ahead and begin discussion, Mayor Jacobs? Is that all right? Or do you want us to wait until he's actually on?
Actually, Mr. Burleson, are you muted perhaps? I don't see him in here either.
I don't see him. I'm not sure who Melissa's iPad is, though. Is that someone at the health department?
No.
No, I can hear you and I can see
Okay.
you, but I cannot see myself for sure.
Okay. Mr. Burleson, are you listed as Melissa's iPad?
Yes, ma'am, I am.
Okay. Yeah, I wasn't sure who that one was. So, so we just finished discussion of a previous, recommendation, and now next on the agenda is 2020-7, which is the restaurant occupancy limitation and early closure regulation. And Mayor Jacobs asked if you could speak to us. So the floor is yours.
Thank you very much. It's an honor to be able to speak to you. We in the restaurants have had opportunities for improvement, as in being able to voice our concerns whenever previous meetings happen, because they are usually with little notice and everything. So we very much appreciate the opportunity to speak today. It is one of those that, first of all, and most importantly, is our people are not sick. Somewhere along the way, it has become decided that restaurants are the hotbed or the big point for the spread of the COVID virus. If it were that the case, our people would be sick. We would have gotten it from our guests. We would have given it to our guests, but we are not sick at our restaurants. We have had one manager who did get it from his child in Knox County schools. And I will be honest with you, I currently have 3 managers who all just tested positive COVID out of 1,250 employees, because there was a fishing trip over the weekend to go to Florida, and they have come back home and they've been back to work. It is one of those, our people as a majority have been practicing safe practices in our restaurants. They are able to, we keep our younger people busy, keeping our younger people at work and busy and not closing early. Our people do not have the chance to go out and have parties every night and leave our establishments where we're able to supervise them, take their temperature, make sure they're practicing good safety health practices. And rather than sending them away early to go out and do the things that young people might want to do. At the same time, the 50% closure has been very difficult on all restaurants in town. We tried to submit a letter in the portal earlier today from as many independent restaurateurs as we could find this afternoon. They're all in agreement that the months of March and April proved so devastating that whenever we lose the good weather and our patio seasons, our restaurants are not going to be able to survive anything lower than where we're at 50%, and we're barely making it at the time. And really, when you get down to it, restaurants are some of the best sanitized, clean, well-run operations in town. And I would say Dr. Buchanan's inspectors who come see us all the time, they are not, even though they have visited the restaurants in this community day in, day out at the majority of their work time, they have not contacted the coronavirus from the restaurants nor their experiences in the restaurants. I believe they've had one inspector who may have gotten COVID from another case, but even Dr. Buchanan's people have been safe and healthy in our restaurants. We are trying to do our part, and we appreciate all the recommendations, and we're trying to follow all those recommendations, but we would please request, almost to beg, to them as they are, since restaurants are not the place where people are getting sick, nor are they the place where we're sending people to their deathbeds. I think the nursing home industry's got a bigger problem than the restaurants do. And it's one of those that if you let people have more free time, they're going to have more opportunities to have bad judgment and do more things together than if we keep them busy at work, keep them being a productive member of society, and keep them employed, especially at this time of year. We do not have any chance to have PPP money to bail us out, or any chance to have any money to give these people over the holiday season when families become most important. I think our people want to be safe and healthy, but closing the restaurants earlier, limiting our seating. As an Aubrey's restaurant, we have 28 tables. To say that we can only seat 7 tables in the restaurant is not enough to maintain the facilities that we have to pay the banks for, nor pay the employees for. And it is a situation that would leave us with little opportunity to survive. And very much appreciate Mayor Gibbs asking to let me on this Zoom call tonight, and very much appreciate you listening to our few minutes that we restaurateurs in town are trying to do our best. We feel the inspectors of Dr. Buchanan know we're doing our best, and we're not making people sick in our restaurants. But thank you.
And thanks, Mr. Burleson. Just a quick question, and then I'll open up to anyone else. So at your restaurants, are you running at about 50%? You seem to indicate that.
Yes, ma'am. We're running at 50% in all the Knox County restaurants. There are 1 or 2 counties, Bradley County in particular, that is, they have allowed us to go a little bit higher than that. But Knox County, we are running at 50%. If you could come to our restaurants, we have tape on tables that we're not seating those tables. It's every other booth, and tables are 6 feet apart for sure.
Okay, thank you. Other questions from members of the board?
I'd like to ask a question to Mr. Burleson, and also to give some information to him based on some data that I have that we talked about Friday. Mr. Burleson, you all have been over backwards. The restaurateurs here have done, in general, a very good job. I just want to thank you for that. I've spoke to 2 other owners today at length, and but we need some feedback from you. And here's the issue. I believe, as a person who looks at the science, that it is not your staff or your managers that are part of the problem of spreading COVID. It is instead patrons who come in, who use your location as a place to meet, and therefore sit across from each other for 15 minutes or more without masks on many times because they're eating and they leave them off. And that's where the exposure really is. It's not you giving it to them, the patrons giving it to your staff, it's the patrons giving it to each other. So given that, and there's data showing, mobility data that's been looked at around the country in 10 metropolitan areas, showing that that is more the issue. Would there be other things that you as a restaurateur might be willing to accept versus changing percentages of tables open, such as what the state of Washington did, which was they did a temporary single household requirement for anybody eating out. So the whole state went to that. They did not, when somebody went to the hostess or host, it was noted that only one household could be seated together. And they did this as a temporary measure across the state. Have you heard of that? Would you be willing to consider something different of that sort? Because we need to diminish the interaction between non-households at restaurants. You are not the problem. You are just the meeting place for the problem. So I'd like your input.
I would suggest, I have heard of the one family per table situation, but it's one of those that the one family is not suffering as the restaurateurs in this town are, because the individuals are going to continue to meet either at work or at church or on the front steps of the Kroger as they go in together. And that by continuing to limit the restaurants, you're singling out one industry that is already on shaky ground with very small margins. And at least we're able to maintain cleanliness for all these people, that they are going to continue to do it in their private homes. There are still weddings in this town going on that are quite fancy without the restaurants. In some ways, we are providing a community service for them to meet in a clean environment and not have them out and about in the community in a randomness that is uncontrollable. And we would suggest that we can maintain, we continue to ask people to wear their mask as they enter the restaurant. We continue to ask people to wear the mask on the way to the restrooms. And that if they're meeting at work or if they're meeting on any other private activities, closing restaurants down is not the solution at this time. But we as restaurateurs, I know I've talked to you today, we would just like to be able to have a time to communicate with you and express our point of view, which is we're very thankful for today.
Mr. Burleson, I'm very happy you're here because you're one of the main restaurateurs in town. I appreciate your input, but we need to look at what the data shows, which in our case, mobility data in our county shows our restaurants as our main meeting place, at least on public property during the last week. And so looking at, we can look at over 700 locations in the county. It showed restaurants as the kind of the main place where people are interacting for more than 15 minutes. In numbers greater than 100 for the week. So, I don't want to put anything more on restaurants. You're right. You have a lot on your table. You have done great things to keep it clean. You're following the regulations. But we have people meeting there in your restaurants who are meeting and causing these interactions, which is out in public, at least the number one place that we have. So some sort of limitations on either number of households, number of people would probably be more palatable than doing a 25% and closing earlier. I would like to avoid that because I know that this time of year is the time of year that restaurants try to make up for bad times, the next 30 days. And we don't want to put people out of business, but we've got to balance it with a public health need to try to decrease that mobility and meeting in certain locations. Unfortunately, it just shows that restaurants are in Knox County. We like to eat out here. So
I would suggest people are eating out less and less in Knox County. You can, even the last week, numbers have gone down as the media has, I could use the word stirred up the story. But at the same time, I will say there's much more public gathering at Lakeshore Park as people walk in groups, not family units, walking around the park and enjoying exercise or whatever the fresh air, that their groups are doing this very closely together. Whereas at the restaurants, we're at least keeping everybody 6 feet apart. And cell phone data would say that, yes, people are coming to our restaurants, but those are healthy people coming to the restaurants. Those are unfortunately people who have the sickness. You know, cell phone data just means a lot of people have cell phones and we're getting out and about. Even my cell phone, I'm going from Chattanooga today and I'm going up to Greenville tomorrow, and I could be in Bristol by the end of the week. So yes, I'm traveling, but that doesn't necessarily correlate with restaurants being a clean environment and the people who are using our facilities.
Well, again, I appreciate your input. I'll let other people ask questions and give input on this. And I think each of us on the Board of Health need to hear, tonight, be able to say to folks what we feel could be done to help out right now. We have these different possible regulations in front of us, but we need to talk about all the possibilities. And I think each of us need to kind of step up and maybe say a few words about what we want to do. In my case, I would prefer not to ratchet down too hard on the restaurants, but try to find ways to diminish those interactions either through household contacts, limitations, or either single household or double household with small numbers, and do it for a defined period of time.
I apologize for interrupting, but when the numbers first started going up in July, it was bad for our business, of course, as more people stayed home. And the age group that is most successful, possibly going to the hospital, they have stayed away continuously. But the groups that were quote, spreading the coronavirus, being the age groups of 11 to 30, they do not fear the coronavirus as a senior adult in the community. And it's one of those that, if they're meeting in our restaurants, they can also go to the Pilot or the Walmart or the Kroger and buy beer and go to a private home, and nothing is being gained by that moment right there. Doesn't necessarily have to be a clean environment. They're still going to, it's like kids when you ground them, grounding a kid means they're probably going to jump out the back window of the house and go see their friends anyway. It's not the public meeting place of the restaurants causing the problem. It's what I'm trying to reiterate once again. And I appreciate that the board wants to do the right thing, but in the effort, it's almost like they're firing a cannon at the restaurants, but they're missing the entire, they may take out a tree, but they're missing the entire forest on this one, because we're not the problem right here. We want to be partners in this. And Dr. Buchanan's inspectors know that we're trying to be partners in this.
Dr. Souza, I had a question, if that's okay.
Yeah, go for it.
So this is James Shamia, and I also want to reiterate that I appreciate you being here and your perspective. Going back to your original comments about the 50%, and I think that you made that pretty clear that at least in Knox County, that you are really, that's how you're operating your businesses. Now, I was not aware that, I guess, based on the fact that we don't have a specific resolution in place in the county, and then things revert to the Tennessee Pledge, that there was necessarily something fundamentally binding about being at 50% right now. So I wanted to delve into that just a bit. One thing I'll say broadly that this Board of Health has determined is that the simpler the thing that we propose, the more likely it is that it might be followed. And so when we start, so my bias is to focus on percentages, simply because it's pretty easy to determine if a restaurant is at a certain percentage or not. And so I guess my question is, if I went to any restaurant in town today, would I reliably be able to say that they were at 50% as you have described, and are you at peace with 50%?
We are trying to make 50% work for us right now. And no, I'm not responsible for every restaurateur in town. And obviously, some people are going to push the boundaries, and I can appreciate the fact that it's hard to, force people to follow a direction. We need to entice them to that it's in their best business sense to follow the directions. Our guests want Aubrey's to operate a clean, healthy, safe environment, and that's what we to do. Other operators may not, the power of the dollar may be a little bit more strong than trying to do that thing. I don't know if I answered your question, but we are trying to operate at 50%.
No, you did. And just one additional kind of from a public health perspective, and we've seen this in a variety of settings, that congregational dining, just dining together, that you can't be masked when you dine, and you tend to be close knit when you dine. And so just to reiterate what Dr. O'Brien said, I mean, I'm sure your staff are doing everything perfectly around this. And so that the staff to patron interaction is not necessarily the concern here. I did have, you have a unique perspective on something I brought up on Friday. And I have one more question, Dr. Souza, and that is, you mentioned that your business would, at this point, no longer is eligible for the support money. And I guess I'd like to be educated about, from a restaurant perspective, what is available, if anything, from the state. And is there a possibility are you hearing anything that's potentially going to change? Because I bring that up because when Kentucky did a statewide policy, and I know Dr. O'Brien said, and I'll reiterate, we're not trying to emulate what Kentucky did, but part of their policy around restrictions was a support piece to it for restaurants and businesses. And so can you educate me about those pieces?
Two parts to this question. The only reason we are surviving right now is because of the PPP money that came to us in April. That was giving us the ability to pay our bills from the months of March and April, which were the largest losses we've ever had, and we should have been bankrupt by May 1st. Our understanding that there is no more federal money for sure. Unemployment would be merely the $200 some that an employee would get every month if they were laid off. And that the Tennessee CARES money that was there from the state of Tennessee was all used in the cities of Memphis, Shelby County, and Nashville, Davidson County. That we as restaurateurs were told today that there is no more money for Knox County from Tennessee CARES. So at this moment in time, it would be one of those that it would be more devastating for Knoxville because there is no backup plan, no safety net for the employees going into holidays that mean so much.
Just a follow-up question. Was it explained why our county was not eligible or did not receive, or Dr. O'Brien?
The money was spent in Shelby and Davidson counties. There is no more money.
Let me, I've looked into that specifically over the last day and a half. Money was allocated to the state. There were different buckets of money. 2 buckets were for Shelby County and Davidson County as a governmental entity over 300,000, as I understand. So they got special funds. So as an example, Shelby County had money available still Friday to allocate to their restaurants. The rest of the money was allocated for the period of time up through August 31st. And no additional monies have been allocated to that program that we can access at this time. I was working on that today, had people talking with Commissioner Ezel's office in Nashville, and unfortunately there is no money right now. Now the state does have a pot of some money that potentially could have some help out there, but there's no mechanism at this point or guidance, as I understand, that states that we as Knox County have availability of any of that. So we basically, the money that was handed out to Mr. Burleson, the other businesses and governments through the August 31st CARES period, that's gone. And that's my biggest concern. I agree with him. There is nothing more for them as a safety net right now. So if we do that, something to them, as it were, we need to realize it's going to be on their dime that they have to survive.
At the same time, may I add one last point? We mentioned PPP money and everybody is amazed that it happened. The funny part of PPP money is that we received a loan from the federal government through our local banks, and that money sits on our book as a liability. There is a possibility, and that's what we're all hoping for, is that those loans are forgiven. But according to GAAP, generally accepted accounting principles in the back of our heads, and then last week, the Internal Revenue Service confirmed our fears. All that money that is being forgiven will be counted as income. And whenever you have income to the level of the PPP money, that will be taxed at the highest rate of any C Corp, S Corp, personal, or whatever. So if you got money back in April, you're going to be taxed on that money that is to be forgiven at a rate of 39%. So we have to give it right to them come April 15th.
And one quick point of clarification, the CARES Act money went to municipalities with a population of 500,000 or more, not 300, because we would have gotten it if it had gone to 300,000. So that's why Nashville and Shelby and Davidson County got some direct CARES Act money that we were not eligible for because of our population.
Further comments or questions?
I'll just make a comment that I just received that Nashville just published, literally, restaurant capacity is going to be 50%, closing at 10 p.m. Last call and service for food and beverage, no entry after 10 p.m. That just got approved for Metro Davidson County just now.
Yeah, correct. And that's the same as Shelby put into it, I think maybe
Yes,
over the weekend.
essentially
So
what
they
Shelby-
basically have,
but they also have money that they have available to help their restaurateurs.
correct.
Right, Shelby actually has a pretty nice grant program for businesses if you go and look at their reopening plan, in part because they did get some money that we weren't eligible for.
Additional comments or questions?
Mr. Burleson,
Yes.
if, as Dr. O'Brien just said, if we followed a model similar to what Davidson County is doing and Shelby County is doing, would you and do you think your other colleagues in the restaurant industry be comfortable with that as far as your, being able to make it through and survive and keep your people employed?
We are at this time essentially given 6 feet social distancing. We are at 50%. As cold weather begins, more sales from the patio areas will not come back to us. They will be gone as people hopefully order to go. But 10 o'clock is more reasonable because I would say 80 to 90% of the restaurants that that I'm here, I guess, talking on behalf of, we all close at 10 o'clock through the week. The only times it becomes really hard is when there's a UT football game on ESPN and the game starts at 7:30 and the game goes well beyond 11 o'clock. That essentially Sunday through, Friday nights, other than UT football, we are all closing at 10 o'clock through the week. So Davidson and Shelby County is pretty much what we've been doing for quite some time, other than those moments when, everybody's blood runs orange.
Thanks, Mr. Burleson. Any other final questions? Points of discussion? I guess just to summarize, so it looks like Memphis or Shelby County and Davidson County have limited their dining to 50%, and they both have 10 p.m. curfews. I believe Shelby County actually has a limit on 6 people per table for the dining, and I think Nashville might have a limit to 8. So just kind of looking to other cities as to what they're doing. I don't know, at this point, do we want to have a proposed amendment? Do we want to vote on the regulation as it's stated?
I'd just like to say thank you for letting me speak on behalf of the restaurateurs in town, and very much appreciated. And I will let you do your business tonight, but thank you very, very much.
Thank you so much for joining us, Mr. Burleson.
Yes, ma'am. Thank you.
Dr. Sousa, I don't believe we have a motion on the floor.
Yeah, I don't think we do either. So I guess I'll entertain a motion to do something.
Well, you have a motion, you had to approve that we're having discussion of that motion. So having that discussion, I personally think we need to probably mimic what Davidson County has done essentially at the most. I think if we go farther than that right now, the economic impact locally will be pretty substantial. It's trying to do that balancing act between, pure public health, pure public health, we'd have a safer at home order. We're not doing that. If we want to go South Dakota on everybody, we don't do anything. So somewhere in between is what we probably need to look at that could be realistic. Personally, I wish everybody in town would just take 4 days and stay home from Wednesday night till Sunday morning this week and help decrease the chance of spreading disease during a holiday. I mean, that's our biggest fear. Everybody knows starting about 5 o'clock on Wednesday till maybe midnight Saturday, if people could just stay in their households, that would do more than all this talk we're talking about right now, keep us safer for a long period of time. Any order we do right now, I think should be about 28 days because we need, I think, two cycles to look at it. And I would put an end date on it, but I'll throw out there 50% and 10 p.m. amendment of this order. And then I personally would like 6 people at a table as our restriction, but if others want something different, I'm open to 8 too. So what do you all think? Just discussing.
So I'm fine with those changes as you stated them. The challenge we had when we limited the party size was a family who has 10 people in it. I mean, that's a big family, but there are families out there that have that many children. You can't seat them together. If we did that, we need to language it to say that it would have to be unless it's a single household. So that then, we're not splitting mom and dad and the kids up when they go out to dinner.
Yeah, that's what we got to do. It has to be, if it's a single household, there shouldn't be an issue, and we should state such.
Mr. Sanders, have you got any input on?
Yeah, I guess where I'm seeing this, as far as I know, we don't have a framework to hang this on. Nobody's moved any resolution yet, even for discussion. And right now, I'm not seeing, I'm trying to follow, you're talking about looks like you're talking about the restaurant occupancy regulation and early closure, but when you're getting into the group size, you're getting into the other regulation. Now, of course, you can move language from one regulation to the other, but I think it would be helpful if somebody would actually move one of these regulations into discussion and get a second, so then you can discuss it and actually talk about amending specific language in it from one number to another, rather than having these just open discussions without any framework to hang them on.
Mr. Sanders, we had to move that question, at least for discussion, didn't we?
No, I think I asked Mr. Burleson to just go ahead and talk to us.
Okay.
Yeah, that was my fault. Yeah, so I don't think we actually have a motion on the floor for 2020-7.
Well, I'll go ahead and let's formally put that up for discussion. I'll move that we have that we adopt that, and then we will go from there.
Go backwards. Do I hear a second?
I'll second.
Okay. So I guess we've already had much discussion about this. So I guess, is it the will of this board to consider the changes as recommended by Dr. O'Brien? Discussion about that.
So just for Mr. Sanders to talk about when I believe, and Dr. O'Brien can correct me, but I believe what we're talking about is limiting the party size in the restaurant. It's not a gathering. It's limiting how many people you can actually seat at a table, so that you don't have a table of 12 people that don't live in the same household sitting together. So it's not the same as the gathering. It's how many people you can actually seat at a table. Is that correct, Dr. O'Brien?
That's my intent, is just, if it's single household, that's fine. If it's more than one household, I was going to propose 6 people. And again, only for the next 28 days. I'd like to hear other people. Anybody, please?
So just to clarify, there seems like there's a few things kind of moving around. So there's a change in the percentage, a change in the time, and then the table size. And so,
Right.
so, but if we're just in general discussion, then those all seem reasonable.
And if I believe I could share my screen here. Is this gonna pop up, I hope? Is that coming through?
It is. Can you make it a little bigger? Just so everyone can overall.
Yeah,
A
and
little easier.
sorry, let me find my.
Yeah, no problem.
So
Excellent.
this is the regulation section of 2020-7. And what I've done here is simply, as I've been listening to your all's discussion, I changed the 25% to 50%, inserted a sentence about no parties to exceed 6 people from the same household, and inserted replace the 9 p.m. with 10 p.m. This is not, of course, me advocating any kind of policy. I'm completely agnostic on that, but I wanted to simply let you all know what I think you have done so far in your discussion.
Mr. Sanders, I think one additional thing Dr. O'Brien mentioned is an alteration of the date. Again, not that it's been decided, but I think he mentioned 28 days.
Okay. Down.
And I would say that it would go into effect this Wednesday at 12:01 a.m. Wednesday.
That's already there. So somebody needs to count out 28 days from November 25th.
That would be, I think, the
4th.
23rd of December. Is that right?
So we could potentially review this at the next meeting, because presumably we'd probably have a meeting in between.
Yeah. So anyway, that's what I have so far, just for your information. I just so everybody in the group knows what it is you're talking about. I'll stop the screen share now.
Thanks, Mr. Sanders. So additional, I mean, I think that this would put us in line with the other metro areas, and hopefully it could be a little bit more palatable for restaurateurs locally. Other thoughts from folks?
So, Dr. Souza, two thoughts. One is just in general, Mr. Burleson coming and talking to us about kind of the 50% piece. I found that to be very helpful. One thing I think we need to think about as we're putting ourselves, whether it be 14 or 28 days in the future, and we know what the trajectory is of the pandemic, is that first of all, to Dr. O'Brien's point, is that if 2 weeks, whatever happens in 2 weeks has already been, today, and what happened a few days ago is what impacts cases and hospitalizations 2 weeks from now. But even in 4 weeks, I fully expect that, January is going to probably be the worst time of this. And so even in 4 weeks, we may still have some numbers that have shown a rise. And then the question is, how much worse would it have been had it not been for X, Y, or Z action? So I just want to make sure that we're setting, just knowing how this is going to progress, that we don't set a false expectation that, our numbers are going to be just nicely coming down in 4 weeks. It's really a matter of what would they have been if if nothing had been in place, and what are we going to see? Because I think we all have to be realistic about where we are in this pandemic and exponential growth. We're trying to blunt this effect in any way that we can. We're not going to be able to just dramatically turn it around. And so, does that make sense?
Yeah, no, agreed. And I think that's, kind of the same thing that's happened with the mask, is when we get comments that things are still going up, even that we're wearing masks now, how bad would they have been if we didn't have a mask mandate? And so, I know, I'm not sure if other folks saw, but I think it was Claiborne and Rowan counties put mask mandates in over the last 2 days. And so I think that hopefully the counties around us will start to follow suit so that it'll help be a little bit more of a regional effect. But as you said, without taking steps, we don't know, how bad it would have been if we'd done nothing. So other comments, questions?
Dr. O'Brien, on the mobility studies, they do not look at private residences and addresses, correct, sir?
Yes, they do not track any of that at all. It's only on the list for Knox County, as an example, it's businesses, governmental buildings, and parks and schools that are listed. Also churches are on there, but again, no homes at all.
I guess my question is just, we can look at the businesses, but we have no idea what's going on at private residences, basically.
We don't, and they don't track that at all. That's not even available to us.
Ms. Roma?
Might we consider an 8-person limit per table instead of 6? I don't know how I feel about it. I just was wondering if there might be any discussion about that.
Dr. Buchanan, what's your opinion on that? And what if you're talking about when it was too small and people couldn't sit together from one family. So what about the 6 versus 8 for folks from different families?
I mean, I think that that's fine. It's reasonable. It's not, there's no, the challenge is this is everybody's first pandemic, and we don't have the magic bullet of what the numbers exactly are that are gonna make a difference. And I think the other side to that is that allows the restaurants to maybe serve more people, which is good, because when we know this is hard, this is a tough thing to think about doing at the holidays, because a lot of folks are employed by restaurants. They've got kids to feed and shelter, and it's a tough call to make a change that we know is going to impact the income of folks who have other things in their lives and are working hard to put food on the table for their children and their families. So I would be in favor of that. I don't think it makes a huge difference from the epidemiologic standpoint if it's 6 or 8.
And that's what Nashville did versus Memphis did the 6.
So Dr. O'Brien.
I'm sorry, Dr. Schuss. I'm sorry.
I was going to say, so Dr. O'Brien, would you consider that a friendly amendment?
Oh, definitely. I am ready for us to compromise.
Okay.
And this would just be for people from different families. A single family could sit together if they had more than 8. Okay.
Correct. Dr. Drake, you're going to say something?
And how many restaurants have tables big enough for 8 versus 6? I really think 6 is a better number. They don't have that many big tables.
Here's what I was thinking. Many times you'll have 2 4-tops, which is a table that seats 4 people, and they'll be pushed together. And when you have those 2 empty seats sitting there, in normal circumstances, it hurts to have 2 4-tops pushed together for 6 people. So I was just kind of thinking about what that would look like in a restaurant. That's all.
And a fair number of the bigger restaurants here locally have round tables that are 8 tops. So, I know a number of restaurants have those available, including Aubrey's.
They can be 6 feet apart.
I think that's what the restaurants are shooting for. I think that's what part of the Tennessee pledge was, predominantly that they needed to be spaced 6 feet between the tables. Further discussion?
So Mayor Jacobs, maybe not for the regulation itself, but I mean, how do we try to promote just the utilization of takeout? That's one way to support businesses if you're not someone who wants to go into the restaurant, even if you might have otherwise cooked, is just, make a point to do that. Is there any way we can promote that more than we have?
Sure. You know, it's interesting. I have been conversing with Ray DeGennaro, who is an economist at UT, and 75% of the slowdown in economic activity actually happened in the spring before the state level lockdown orders. So people do kind of naturally migrate in the market, as Mr. Burleson said, you know, with so much now and unfortunately the higher cases, I think that people are very aware and are more likely to do takeout. That's something that we encouraged when, you know, when the restaurants were shut down from dine in, and we can go back with that, you know, was ordering out. And, you know, I think that's just a matter of other folks in the community and the restaurants as well. And I think they've also done a real good job of making it easier for people to dine out, as well as Dr. B, is the governor's order about takeout beer and drinks and all that from restaurants, is that still in effect?
It is. It stays in effect till the
And
end of December.
I think that helps as well. So I think it's just something that we could just all promote.
Yeah, we need to get behind that. We need to just tell the citizens right now, please, you know, we want you to stay home this weekend, but I want you to order food. You need food, you got to eat. And if we can do more takeout, places do have places to pull right up. They've got signage that you can call in. You can do total contactless. So let's strongly encourage the community to go that route.
Any additional discussion? So I think we agreed that we're going to a maximum of 8 per table.
So Dr. Souza, if I can suggest that we
Please
go
do.
through what changes to a proposed regulation 2020-7 were made, because the original regulation in the form it was on your agenda was what was moved by Dr. O'Brien, because there's nothing else to move. So go through the proposed changes that you think you've made. Make sure that both the mover and the seconder agree with those as friendly amendments before you vote.
Okay.
And that way everybody knows what was voted, and Dr. Buchanan can get all this down as the secretary so that we have the right regulation when we're
Got the
done.
right notes. Okay, so what I've got for our changes to this ordinance, so this is 2020-7, that dining would be changed to 50% instead of 25%. That the curfew would be 10 p.m. instead of 9 p.m. And that there would be an additional language put in limiting tables to 8 people if they were not from the same household. Is that everything?
I believe there's also the change at the very end regarding the expiration.
Oh, and the
date.
expiration,
Now,
yes.
December
So a
23rd.
28-day expiration.
28
with-
day from whatever the
Right,
the
with
effect
possible
from
renewal.
November 25th, which I believe that's right, is should be 23rd.
So that's the motion that's on the floor. So those 4 amendments to that we
As
would
the
be voting.
second, I'm fine with those. Dr. O'Brien, I believe you were the first.
I am in agreement with all 4 of those.
Okay. Any further discussion on
I'd like-
2020-7 with the 4 changes?
I would like to know, is it 8 people from the same household at a table?
No, so it'd be a maximum of 8 people if they did not live together. So if you had 7 kids and mom and dad there, you'd still be okay with 9 people, as long as you're all in the same household. It'd just be 8 people if you don't all live together.
It's the same household, not mixed.
Well, they could have up to 8 if they don't live together.
And you could have more than 8 if you have a big family.
Right.
If you have like grandma and grandpa that live in the house and you got 4 kids and, you know, somebody coming in, they all live in the same house, they can sit together.
Any further questions, comments? All right, hearing none. Narda, could you do a roll call on approving 2020-7 with those 4 amendments?
Yes, this is Narda Capicilli, and we're voting on regulation 2020-7 with the changes. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
9-0, passed unanimously. Thank you.
All right, thank you, everyone. So the next on the agenda will be the 2020-8. And I just had a quick question for, I don't know if Dr. O'Brien or if Mayor Jacobs, if you know, I know that we mentioned that Shelby County has this CARES Act fund. When I was kind of poking around, seeing what they were doing for dining today, they've got a COVID-19 relief fund that includes CARES money, as well as it looks like money from nonprofits, donors, things like that. Do you guys have information on what that is, and if that's something that could be explored for Knox County?
As Dr. Buchanan said, what had happened was that counties, municipalities with 500,000 or more people got extra money, their own pot of money from the federal government. And I believe that that's what they are tapping into there. Is that correct?
Yeah, well, I guess because I was reading and it almost looked like they had additional funding sources,
Yeah.
you know, outside the federal government. And so I don't know if that's something that is possible that could be pursued by your office or something like that to help folks out. In this
We had looked into some other funding sources possibly for grants to small businesses. The only, the issue is, even with Kentucky, I think it's a maximum of $10,000 that a restaurant, for instance, can receive. And for a lot of those restaurants, that's about a day's operations, so that would be potentially a very significant amount of money for the county to do. We can certainly look into if there's any more, if any more money becomes available from the federal government, but that usually for us, that will filter down through the state.
Okay. All right. Thanks. Just wanted to ask that since I found it today. So moving on to discussion about 2020-8. This is the social gathering limitation regulation. Do I hear a motion on this?
Motion to pass or accept, whatever.
In a second.
Second it.
Okay. Thanks. I did it in the right order this time. So open for discussion. Dr. Buchanan, do you want to maybe just give us a quick rundown of what's in this, just to make it?
Sure. We'll screen share it also. So this is a regulation to limit social gatherings, and social gathering is defined as an event, assembly, or convening that brings together multiple people individually or from separate households in a single location, indoors or outdoors, in public or commercial places, with a significant purpose of the gathering is for social purposes. These are things like family reunions, parties, barbecues, picnics, club meetings. This does not apply to in your home, doesn't apply to places of worship, doesn't apply to places leased or managed by the government, private or public schools, like waiting in a bus terminal, healthcare facilities, gatherings for political reasons. And it also, one of the things we found in, forget where, excluding individuals who are experiencing homelessness. And it also excludes nursing homes and long-term care facilities, since we don't have any authority over those things. It doesn't apply to weddings or funerals, since, again, those are excluded through executive order. So really the idea is to limit the number of people who are coming together based on the fact that we do see spread of COVID in these social events where people get together and they're comfortable with the people that are there and don't think they're going to give them COVID, and they, really drop their guard. And in this season of, I know it sounds terrible, but in the season of holidays, and we really want to encourage businesses to find other ways to celebrate the holidays with their employees, and rather than bringing everybody together for an evening of partying. Right now, we'll have to leave that for later.
Thanks, Dr. Buchanan. And I think to note, and correct me if I'm wrong, but I believe Nashville has something similar to this in place, don't they, or Davidson County?
You know what? I looked at a lot of stuff and now I can't remember. Who has it.
It's all running together. Yeah, I think that's what I found, looked up earlier today, that they've got a similar.
Yeah, and so I don't know where'd this quote come from. Charity just wrote a quote. Oh, something we heard today is each new person added to a group is an added invitation of risk with this level of spread that we have in our community right now. I mean, that's the real challenge that we have, is that, you know, there are no hot spots anymore. All you know, not the entirety of Knox County is a hot spot. And that's why we're really trying to encourage people to limit risk and putting things in place to help limit risk. This is, you know, the challenge of this time of year and people wanting to come together. We do expect to see some spikes. I know Dr. Shamia was talking about, you know, what's happening now is a result of 2 weeks ago, and 2 weeks from now we'll have the result of what happened now. And so our, you know, our hospital systems are under strain, our cases are going up. And like I said last week on Friday, you know, we continue to average at least a death or two a day, if not more. And those are Knox County residents that are dying from COVID. And that's heartbreaking. And so as a community, we've got to come together to slow the spread, and limiting crowd size is one way to do that.
One quick question, and I didn't catch this when I read it earlier. Was this a 2-week or was it also a 4-week?
I actually made them both 2 weeks, knowing that we discussed the length of time.
Okay, so I might make a friendly amendment or propose a friendly amendment to make it 4 weeks, just like the restaurant one we just did, for consistency.
I'm fine with that. Dr. Drake, are you okay with that?
I am.
Okay. Excuse me.
Any questions, concerns, discussion?
May I ask, please, for somebody to educate me what's been in place previously regarding specifically outdoor gatherings and what number has been permitted until now?
Currently, we don't have any limits on gatherings at all. In the past, we've had 25 people limit, I believe that's what it was. And, you know, I think outdoor gatherings are safer, but they're not completely safe, and you still need to maintain distance. And so that's why I included those in this regulation. We wouldn't impact, you know, sporting events, those kind of things. These are more gatherings that are really just for social purposes. I mean, I know people socialize at sporting events, but that's not the primary purpose of a sporting event.
Go ahead, Mayor Jacobs.
I'm a doctor again. Dr. Buchanan, we've had some folks that do things like addiction therapy, Alcoholics Anonymous, and so forth, that are concerned, you know, with isolation, and will sometimes have groups of more than 8. How could we be able to accommodate them with this, or can you?
It's, you know, so that's a great question, and I'm thinking about a way to make it, because what we'd have to do is make an exception and put it under paragraph 5. So actually, the other thing I don't see on here is it doesn't include, we may have left off another, healthcare facilities. Okay, that's on there. If you could think of a way to language that, Mayor Jacobs, that would include capture the groups that you're talking about and the functions you're talking about. I hear what you're saying and I get it, but I can't think of a way to say it. So,
Mayor Jacobs,
Mr. Sanders.
may I follow up for a second? are you asking about the actual meetings, or are you asking about social events outside the actual meetings?
The meetings.
Because the social definition, the definition here, and I'm sorry, it's going to take me a second to find the social gathering definition, but the social gathering definition says says it's for purely social purposes. I wouldn't call a meeting of AA or something similar to be for purely social purposes. I don't think those meetings were ever captured within this regulation.
Okay, thank you for clarification.
I do have a question though. If you look at the last example, it's a club meeting. So do we need to change that to a club social or a club party? I don't know. I'm just asking because if
That doesn't sound like a club meeting. I mean, this is healthcare.
okay.
Any other questions, comments?
I have a question, just for my own knowledge, because now this is I'm wondering how this might affect things like races, like a turkey trot that might be coming up in the next few days. Would that fall under purely social, or is that not part of this?
I would not consider that part of this. And again, there is socialization that happens, but that's not the primary purpose of having that event. But hearing all this discussion, I'm just wondering if we need to clarify some of this before with all these questions. It's hard to capture all of the exceptions when you do these kind of things. So, I'm sorry.
So, Dr. Buchanan, what do you sense will be the enforcement piece of this? Because I guess that also, as we talk about clarifying the language, and because a lot of this gets back to intent, although the language can't be so nebulous that it's totally in the eye of the beholder. So what's the enforcement piece, Dr. Buchanan, for this?
Sorry. So the enforcement piece is the same as enforcement for all of our regulations. It falls to law enforcement to decide to issue a citation. And I don't know the law well enough to know what kind of things are possible for this. If you look at Tennessee Code and regulations of the board, Mr. Sanders, help me out here. What kind of violations are they considered? And what
most of these most of these regulations recite the violation of a Board of Health order is a Class C misdemeanor, and that's pursuant to the Tennessee Code. Of course, the enforcement piece is beyond the purview of this board. That's up to law enforcement agencies and the District Attorney General office to prosecute or not prosecute, or to cite or not cite.
Can I ask a question about paragraph 4, Mr. Sanders? It appears to be from the prior regulation we had and does not appear to match what's talked about here.
Sorry, I'll have to take a look here. All right, so the paragraph 6 should be a reference to paragraph 5. That was just when we were drafting this, we eliminated a paragraph at one point, forgot to renumber that. So the paragraph 6 reference and paragraph 4 should should be included. The exceptions, that is, exceptions should be paragraph 5. So change 6 to a 5.
Yeah,
but as for the overall paragraph, I believe it was Dr. Buchanan's intent to put that into this regulation as well. That is, so there, and Dr. Buchanan, feel free to jump in if I'm misstating what I think your intent is, but the intent is to say no social gatherings as they're defined, but also no gatherings within 30 feet of the restaurant, clubs, etc.
That 900 square feet fits 25 people. That's why I'm saying that, based on the 6 foot. That was used for our 6 foot 25 before.
Right. Says, well, it says that all public or private gatherings of more than 8, or if that square foot, yes, I see. I did not catch that. So yeah, feel free to edit that out and chat. Dr. Buchanan can speak as to whether that was her intent or not.
I'd have to say that probably was just an oversight. I'm just going to be honest. And so, again, I kind of go back to, I'm wondering if this needs to be, needs a little more work before we can pass it. It's not something a business has to plan for. And so I'm just wondering if it needs a little more, just wondering out loud if it needs a little more work before we pass it. So that it's clear and people can follow it. And that's
Right.
what I'm hearing, is it doesn't seem clear for people to be able to follow.
I think if I can, if this board itself is confused as to what it's trying to pass, then the public doesn't have much chance of being able to understand what's required of it. So I would think that might be a wise thing. I will say that typically you want to give the public at least 48 hours from the time you're passing a regulation till it goes into effect. So you probably are not going to be able to bring this back up again on Wednesday, vote on it, and have it go into effect Wednesday night. You're looking at Friday at the earliest if you vote on it on Wednesday.
Yes, I'm aware of that. Thank you.
Dr. Buchanan, did you want to withdraw the motion?
Yeah, I do. I would like to withdraw it and bring it back for consideration on Wednesday.
Okay.
I feel like there were enough questions and it just needs some clarity. And like Mr. Sanders said, the public needs to be able to understand it in order to be able to follow it.
Okay. And I think in the 2020-A, I think we sort of hit the points of this, although it wasn't necessarily a regulation per se. So at least we've already got that on the books. Okay, so hearing that withdrawal, we'll go ahead and move to our next item of business, which is other business. One thing I was going to bring up, and I'm not sure how this changes now that we just delayed 2020-8, is I was going to ask if we need to have a meeting on Wednesday, since we're having one today. If the board does want to review the social gathering limitation again on Wednesday, then obviously we will have a meeting.
Do we have to have a meeting, Mr. Sanders, if we decide today to cancel?
No. You can cancel a meeting anytime.
And if we do meet, Mr. Sanders, you're saying we can or cannot address the social gathering limitation on Wednesday?
Well, you can put it on the agenda if you would like. I'm just saying that you need about 48 hours, I would like to have between the time you vote on it until it takes effect. That is, you can't very well expect people to follow a law they've not heard of yet, or regulation in this case. You need to give them enough time for it to be publicized.
I'd like to ask fellow members, would you want to consider not having a meeting Wednesday, but have a meeting the next Wednesday and potentially weekly through this more difficult time? Just a thought.
I'm fine with that, if everyone else is.
I
I think I'd be fine with that. I don't know if Martha, if that's too difficult on your staff to go back to weekly or not.
we'll do whatever needs to be done. We're good. And I'm fine with that. I know that I won't, well, no, I will be, never mind. I'll be.
Dr. O'Brien, just a question about weekly. I mean, there's really a finite number of actions that we might have before us. And so, I mean, you know, if part of that is information dissemination, if it's reiterating kind of the recommended actions, but we also know that the trajectory of the virus only changes so fast. So I was just trying to get a sense of, if we go back to weekly, what's the kind of the end game of trying to accomplish?
I think the only thing would be just more providing information to the public, not making new regulation decisions potentially, but getting that information out. The other thing that we could do instead would be to publish. We always have the benchmarks, but we have your data that you provide. That may be something that we could publish in lieu of another meeting. So we could, and we could offset. We could drop this meeting this week, have the meeting the next Wednesday, and then have the next meeting 2 weeks after that. I'm open to whatever. I just think information out to the public is important.
Yeah, so just looking at the calendar, if we did do that, excuse me, our next meeting would be December 2nd, then the 16th, and then the 30th. Which seems like that's a reasonable spacing and doesn't interfere with, I believe, any holidays with the county.
So Mr. Sanders, I believe we determined that giving the data on the off week meetings, as long as that was available to the public, that it would be fine to provide the board data on the weeks that we don't have a meeting.
Yes, and just make sure the public gets to see it too. I believe there's been a page or something set up on the website so the public can see that kind of information. But just don't talk about it, obviously, just distribute it.
Dr. Souza, I would support that schedule you just described.
Okay.
Second.
Is that okay with everyone else? Basically December 2nd, 16th, and 30th through the month of December. And if need be, if we have to call an emergency meeting, obviously we can do that.
Absolutely.
Do we need to vote on that?
It's probably within the purview of the chair simply to call the meeting, but you can vote on it to make it official if you'd like.
Well, I'll make it official since Dr. Gocher's not here and I'm only his stand-in. I don't know if someone would like to make a motion to have our next 3 meetings, or I guess to cancel the meeting this Wednesday, and then have our next 3 meetings December 2nd, 16th, and 30th. I don't think I can make a motion.
I'll make that motion.
Okay, second?
I'll second.
Okay, great. Narda, could you do a roll call?
Yes, this is Narda Capicilli, and we're voting on the upcoming dates of meetings. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
Thank you. Passed unanimously.
All right, great. So any other business that needs to be brought up?
I'd just like to thank the board for hearing Mr. Burleson and your flexibility. And I also like to remind the public, as Dr. O'Brien said, this is a serious issue, and I don't think any of us want to impose more regulations. So please exercise personal responsibility and follow the guidelines that have been set forth. Thank you.
Thank you, Mayor Jacobs. Any other business to be brought up? If not, I will entertain a motion to adjourn.
I'll make a motion that we adjourn.
All right, well,
Second.
we are adjourned. Everyone, hopefully have a good small Thanksgiving, and we'll see you back in about a week and a half.
Thank you.